Tuberculosis is a highly infectious disease that affects primarily the lungs. According to World Health Organization, about 1.5 people died from this disease in the year 2020. Tuberculosis is mostly common in developing countries, and it also radiates to other parts of the body. It affects other parts of the body, which includes the brain and the spine. Welcome to Healthcare Pro. My name is Favor. I'm a paramedic in training, and in this video I will be educating you on the things you need to know about tuberculosis. So please stay to the end of this video so you don't miss any important information. Now let's get right into it. There are two types of tuberculosis. The first being latent tuberculosis. This is when someone acquires the bacteria that causes tuberculosis and do not present with symptoms. The tuberculosis can stay dormant for years before developing into the second type, which is the active tuberculosis. This is basically tuberculosis that causes many symptoms. While the symptoms may be associated with the respiratory system, it can also affect other parts of the body, depending on where the tuberculosis grows. Some of the symptoms include coughs lasting more than 3 weeks, coughing up blood and sputum, night chills, weight loss, chest pain, fever, and loss of appetite. For the fact that latent tuberculosis do not have symptoms, only skin tests and blood tests can actually show if one has it. Tuberculosis is spread by bacteria that flow through the air, just like the cold and flu. You can get tuberculosis only if you come in contact with someone who has it. Therefore, there are risk factors of contracting tuberculosis, and these risk factors include when you work in a healthcare facility or in a nursing home, when you are a smoker, and when you come in contact with a friend, a family member, or a co-worker who has tuberculosis. When you are diagnosed with HIV or having any other immune compromising situations. How then can you prevent tuberculosis? Well, for starters, if you are traveling to any part of the world where tuberculosis is very common, it is advisable that you stay away from crowded places and spending less time with sick people. Vaccines are available for children in countries where tuberculosis is very common. So it is advisable that you make your child or any children around you take these vaccines because it can help fight against the disease. If you have latent tuberculosis, make sure you take all your medications so it doesn't develop into active tuberculosis. And if you do have active tuberculosis, please, whenever you laugh, cough, or sneeze, make sure your mouths are covered so you don't spread it to other people around you. It is also important to note that a person with HIV is at a very much risk of having tuberculosis. I hope this video has been educative to you, and I hope you've learned something new. Do not forget to like this video, and please, if you find it educative, do subscribe to the channel so you don't miss any new videos. Thanks for watching.